Do you ever wonder why some kids can't just enjoy a regular chocolate bar like others? Or why a simple protein in food could harm a child? That's where phenylketonuria (PKU) comes in. Imagine your body is like a kitchen that breaks down food. But in PKU, one tool, an enzyme needed to process a part of protein, is broken. This part is called phenylalanine. When it can't be broken down, it piles up like garbage and starts hurting the brain. This disease is usually found right after birth, yes, even before the baby eats solid food. So although you might never feel heart pain from PKU, the real damage happens in the brain if it's ignored early on. Got it? Let's break it down like a story. So what causes PKU? Think of your body like a car. It runs on fuel, and some parts need instructions to work. These instructions come from your genes, passed from parents. In PKU, a baby gets two broken copies of a gene, one from each parent, that normally tells the body how to make an enzyme called phenylalanine hydroxylase. No enzyme means phenylalanine stacks up. If both parents carry the broken gene, there's a 1 in 4 chance the baby gets PKU. It's not your fault, it's just a genetic roll of the dice. Fun fact, most parents don't even know they carry it until their baby is tested. Kind of like finding out you've got a secret you didn't know about. Now, what happens when phenylalanine builds up? At first, a newborn may look perfectly fine, like any happy, tiny baby. But over weeks, signs start showing. Imagine a baby who is unusually sleepy, doesn't grow well, or has skin rashes. Some may even have a mousy smell in their sweat or urine. Scary part, without treatment, the baby's brain doesn't develop right. They might have trouble learning, delayed speech, or behavioral issues, like always being upset or hyper. Think of the brain like a construction site. Too much phenylalanine is like using bad materials. The building won't stand strong. Catching symptoms early saves the brain before damage happens. Good news, PKU is caught super early, usually within 24 to 48 hours of birth. How? A tiny heel prick test? Yes, a few drops of blood can save a life. Labs check if phenylalanine is high. If it is, more tests confirm PKU. Now, treatment isn't a one-time fix, it's for life. The main rule, avoid high-protein foods like meat, eggs, cheese, and even regular bread. Instead, the person drinks a special medical formula that gives protein without phenylalanine. It's like swapping regular gasoline for a special clean fuel that keeps the engine safe. Also, regular blood tests help track levels, kind of like checking your phone battery to avoid shutdown. With careful diet, people with PKU can live healthy, normal lives. Can we prevent PKU? Well, we can't change genes yet, but we can prevent the damage. Since PKU runs in families, couples with a history can get genetic testing before having kids, like checking the weather before a picnic. If both parents are carriers, they can talk to genetic counselors to understand their risks. And once a baby is born, newborn screening is key. It's like a safety net catching problems early. No baby should suffer brain damage when a simple test and diet can stop it. So yes, while we can't prevent the gene, we can 100% prevent the disease's harm with quick action. Scientists are not stopping. One big breakthrough is a medicine called sapropterin QVen. For some people with PKU, this pill helps the broken enzyme work a little better, like giving a rusty tool some oil. It doesn't work for everyone, but it can ease the strict diet. Even cooler, gene therapy is being tested. Think of it like sending a fix to the broken instruction manual in the genes. Early studies in animals show promise. Also, new enzyme replacement therapies, like PAL therapy, are in trials. Imagine giving the body the missing enzyme directly. It's like sending a new mechanic to fix the engine. While not ready for all yet, these advances give real